Hey loves, today I want to show you guys a release for your hip flexors. So this is a manual trigger point release that you can do on yourself. You can also use a partner if you have somebody in your life. It's actually easier for them to access it. And so not everybody can get this on themselves depending on your stature and your personal strength. It can be kind of uncomfortable, but if you have low back and hip pain, oftentimes we're like rubbing our low back to try and get that to release, when often the issue is actually in our hip flexors, which are deep muscles and can be tricky to get to. There's a wonderful book and tool called the hip hook, and she actually was a physical therapist, the woman who wrote the book. It's actually called Tight Hip Twisted Core, I believe, and she teaches you to lay on this tool. I would say this doesn't work for all body dynamics, all forms. It can be uncomfortable, it can be painful. This work can be a little painful anyways, but you've probably heard of like the psoas or the Illiopsoas, and those are muscles of the hip flexors, but that often leaves out the Illiacus, or it umbrellas the Illiacus and doesn't necessarily address it. The Illiacus is like the inside muscle. It's on the inside of your iliac crest of your hip bone, and so it can be tough to get to, and it's why it can remain chronically tight for long periods of time and often never get addressed, even with some really good body work a lot of the time. And so that's something we're going to work on today. You may want a vibration tool if you have one, and then you're going to want to be on a flat surface like the floor is ideal, or a massage table. And then if you have a partner working on you, you're going to want them to come from your opposite side of the hip they're working, so that they can have a straight hand and they don't have to muscle with their hand as much. They can use kind of like their arm and body weight to get into that. Now, the other thing that isn't talked about enough with this is the QL, which is the quadratus lumborum, and you'll hear me talk about that a lot in other videos, and it's not what we're specifically releasing right now, but it does have so much to do with hip flexion. So hip flexion is not just the Illiopsoas. There's a lot of muscle groups engaged with these movements, like bending the knee and twisting, rotation, adduction and abduction, and so just know that these are two of the primary hip flexors that we're going to work on. Okay, so you're going to lay back, and if it's accessible for you, you're going to go ahead and lift your hips up in a little hip bridge, a yoga bridge, and then set them down and just extend your legs. Now, when you're here, you're going to go ahead and start to palpate, and everybody's body is different. Some people have more adipose to get through, more fat tissue, more muscle, but you're going to work along that ridge. You're going to feel your iliac crest, so that bone, your hip bone in the front and top. You're going to kind of start working your thumbs or your middle finger around and just start feeling. And if you don't have any tenderness in here, that's a great sign that you probably don't have much to release. So you can move on to something else. Maybe do a QL video, a quadratus lumborum, or the queen leader. And so if you do, then I want you, if you do have some tension or discomfort, I want you to start to differentiate, feel in, dig a little deeper, try and get up underneath the inside, and be mindful and be careful. There's a lot of muscles, there's a lot of important vital organs in this area, our sex organs and our digestive organs, so be mindful and don't hurt yourself. You are working along the bony edges, the bony landmarks and ridges, okay? So really working along there and just feeling. Now, if you go right in and you feel like tension or tightness right away, you're not alone. It's not uncommon. That's where you're going to go ahead and hold. And you're going to be breathing deep in and out to your belly. So it's natural. A lot of people, they chest breathe. I want you to work to expand your low belly. I like to call it the Santa Claus breath, because that helps people realize, oh, I actually want my belly to get as big as it can when I inhale. And so you're just holding here initially on wherever you have that tenderness. Oftentimes it's a little higher than where we think it would be. So it's kind of the top and inside of that hip. And you're just getting as much in there as you can. And I'm actually using both my middle fingers and kind of pointers to get in there. But you just work with whatever is okay for you. You can also use a tool, like even the end of a pencil, the eraser end of a pencil can work. And you're just holding here. And now while you're there, I want you to flex your foot. So you guys probably can't even see that. I'm sorry, I don't have the biggest space for this. So I'm gonna scoop up for you so that you can see, maybe, I'll scoop right off the bed. So I'm on that spot. You gotta relax your upper body. So you might have to do it after watching the video, because if you're up like this, like that engages the hip flexor. So I'm looking at you guys, now my hip flexors are engaged, so I can't release them like that. You're gonna have to relax, hold that spot, and then flex your foot. And then as you're flexing, you're gonna start to keep your knee really straight, and then you're gonna rotate out to the side with the whole foot and leg. And you're gonna keep breathing in and out your belly the whole time. And then you're gonna start turning your leg in. You're gonna rotate in, keeping the foot really flexed. And the knee really, really straight. And you'll notice your inclination will be to bend your knee to get more range with your foot. Keep your knee straight. That's actually important. Push your heel away from you. You'll feel the muscles flex more. They'll contract. And keep breathing. And then just keep rotating that flexed foot. Straighten the leg more. And if you find spots that feel extra tight or like tender, you're going to hold and breathe deeper where you feel those tight spots. And then you'll continue through motion. And then you're going to point your toe like a ballerina. Point as hard as you can. So I don't know if you can see, but I'm going to raise it up so you can see. You're going to keep your legs straight down on the table or the ground, but you're going to point like a ballerina while your hands are on that point. And then you're going to flex again. So flex foot, pointed foot, okay? And you'll go back and forth through those. Always point on an exhale and always flex on an exhale. And then you're going to relax the leg, and then you're going to loosen your grip. And then you're going to do the other side. I don't know if you guys, how much you can see my foot, but I'm going to scoot back down. And then you're going to do the same thing on the other side. Or if you do have a vibration tool, I'm going to demo that now. You would use the vibration tool in the same way. And so this is another exercise. So again, you're going to watch, but then you'll probably go through and do it. You can follow along or you can do them. So my voice is going to be like, oh, Luke, I'm your father. But so from here, I'm on that same spot, right up in the Illiacus. Oh. And so you can, again, you can flex and point and do that. What you can also do is bend the knee. And this can help you get even deeper into that flexor. You can also elevate the foot and then bring it back down. And elevate and bring back down. And then you can also let the knee come out to the side and then let it relax completely. Bring the leg back in. Let it come over your midline a little bit. Bring it back. Slowly out to the side. And remember, you're always working with your deep belly breathing. And I'm just holding this massage tool on that spot. I'm not going all over the place. I'm moving my body, but I'm pinning. So this is the pin and move technique with these, okay? And then we're coupling it with neural distraction using the vibration. And then we're going to relax it. Okay? And now if you use a tool on one side, make sure you at least do a little bit of that on the other. Typically, you're going to have one hip flexor that's going to probably feel more tense, tight, or tender than the other side. So go ahead and work that one more, but you're going to want to give them both a little bit of attention. Okay? I hope that you get some relief from that. Again, I know I kind of was demoing a lot and talking a lot, but you can repeat the video or hopefully you learned it and then you can go through and practice. And if you have questions, reach out, let me know how it went. I hope that helps you. It can make a really big difference with hip and glute and low back pain. So love to hear how it's going for you. All right, see you in the next one.